So I want to say good morning, everyone. I'm John Curry, and before we begin, I want to read to you a little something, a little excerpt about black churches. I want to state to you the black church is the only institution that has loved our people from the cradle to the grave. We have loved them through slavery, through poverty, and through racism. We as people cannot make HIV an exception to our love. As the mother institution, I must state, we must love our people through the valley of HIV. And that's, I had to read that, when I saw the excerpt because it shows the premises of part of my presentation, Feeling the Spirit, BTAM Melbourne, educating the community on HIV through our faith sectors. I'm John Curry. I work for Unconditional Love in the state of Florida, where I also sit on the state of Florida Patient Care and Prevention Planning Body. And my co-chairs for the BTAN are Ms. Gail Robinson and Sabrina Torres. Next. Some basic community demographics about Brevard County, which the area of focus is. Brevard County is known as the Space Coast. It's the home of the nation's Space Shuttle mission launch site. The 321 area code was named after the countdowns during the missile launches. And also Brevard County is known as a retirement community for the northern snowbirds. Brevard is located on the eastern seaboard, the Atlantic Ocean, and our beaches are very beautiful. Brevard County also lies 40 to 50 miles east of Central Florida, the Orlando area, which is the Florida attraction areas, and we have places like Walt Disney World, SeaWorld, Fun Spot, and International Drive, which is a host of community shops and area tourists. It is also a major area tourist location. Next, please. The South Melbourne Powell subdivision, across the tracks, so to speak, is my demographic area of focus. And as you can see here, there's a high substance and prescription drug abuse, low income status, high poverty level, which constitutes more governmental subsidizing housing, homelessness, there's little to no job opportunity, and many of the residents feel they're a general conception of disparity, or they just don't care. They have that attitude. Next, please. Basic epidemic profile for Brevard County is there are, as of 2010 census, 543,376 residents, which white residents host 450,927. and the African Americans make up 54,799, and that's overall 10% of the entire population. The Hispanics or Latinos host 43,943 residents. Some HIV prevalence in Brevard County is basically, and this is as of 2010 also, 970 or 58% of the documented cases are white, 585 or 35% of the documented HIV cases are black. And if you remember, blacks only make up 10% of the entire population in Brevard County. And 100 or 6% of the documented HIV cases are within the Hispanic population. Next, please. So I went about part of my Science and Treatment College cohort training. I had an edge, I'm going to say, because I attended the Community Mobilization College a year before this, and a lot of this data came from the Community Mobilization Complete Needs Assessment that I formed for Brevard County. And I did a host of surveys, which I did surveys from the traditional black institutes, which were from the black churches, community member, whether they were HIV positive or not, and I did HIV provider surveys to encompass this data. Next, please. I came up with the problem statement from the survey results, and it reads, new incidents of HIV infections in South Melbourne, they have leveled off, and the surveys from the community members suggest they would utilize HIV services if they can overcome the barriers and in that process gain knowledge on HIV disease. Next, please. And some of the barriers that were identified from the survey results were no transportation, don't know where to find HIV services, many people were ashamed of using HIV services, the cost of services, which can be free, and having no health insurance. Next, please. And some of the gaps that the survey results showed were community members were unaware of HIV services. Community members stated would use or utilize HIV service organization if the barriers were addressed, and community members, they expressed the need for more HIV education. Next, please. And in the Brevard area, we have 3 HIV service providers, Project Response, the State of Florida Health Department, and the organization which I am a part of, Unconditional Love, Incorporated in Melbourne. Out of these service organizations, Unconditional Love, I must brag on us because we are a one-stop shop. Many of the clients utilize our physician services from the health department and also Project Response, giving me more utilizations to interact with Project Response and the State of Florida Health Department during my HIV work within the area, within Brevard. Next, please. So, and I'm going to touch on our goals in just a bit later, but some of the basic goals that we came up with from the surveys was to create a group aimed at educating and guiding at-risk community members toward HIV services, and we wanted to educate community members once again through our Black church. Educate community members from the coalition groups and send them to Black churches to educate the church about HIV service organization. And of course, not only organizations, once we get our foot in the door, we do a complete program. Next, please. Some of the action steps. We were going to address findings from the community member survey results, address the barriers to receiving HIV services, and we were going to educate Black churches on the basic around HIV. Next, please. As we move forward, this is what one of our grassroots events, church flyers, looks like. This is the premises of it. And we usually contract someone HIV in the HIV profession to be as a guest speaker, whether it's pharmaceutical rep, whether it's health department staff, whether it's physician services. And the areas that we cover during these events, grassroots, are HIV education. We talk about the service locations. We have HIV disclosure stories, and we offer free HIV rapid screenings. Next, please. So, as we move forward, remember I started this community mobilization in 2012. The 2012 Stop HIV Stigma Coalition that was formed on the African American HIV University Community Mobilization College cohort. We became the Black Treatment Advocates Network, BTAN, in the city of Melbourne. Next, please. And some of the partners that are within the BTAN Melbourne are God's Golden Girls, which is a church ministry. Many of them are faith-based. The Church of United for Family Values, very active role. We have Unconditional Love Incorporated, the organization I work for, the Brevard County Health Department. We have the Orange County Health Department, lead agency staff within the state of Florida. Brevard is part of Area 7, which includes Orange County, which is Orlando, one of the major areas most impacted in the Central Florida area with HIV. And once again, Brevard, Orange, Osceola, and Seminole County make up Area 7. I hold a great part in that planning process because I am, once again, the state representative for Area 7. And we have Triumph Church, which is faith-based. We have representation from the Brevard County School Board, the other ASO in our area, Project Response. We have another church entity, Faith Outreach Christian Center. We have members from the city of Palm Bay. Palm Bay and Melbourne borders each other. The epidemic in the area where which my focus is, the 32901 through the 32909 area code includes also Palm Bay. And we have members from the Zeta Phi Beta sorority, Destiny Life Ministry, which is a major church, and two of the largest African American churches in Brevard County, Mount Moriah Missionary Baptist Church and Macedonian Missionary Baptist Church, are partners. I will say I'm very pleased, I'm thrilled that Mount Moriah Missionary Baptist Church have really stepped up the game as far as, I gotta say it that way, as far as HIV services, and really become engaged in the work that BTN Melbourne is producing in the city of Melbourne for our residents. Next, please. So as I implemented BTAN in the city of Melbourne, some of the things, this is basic flyer, once again, composed by Black AIDS Institute, but back in January when I implemented BTAN Melbourne, we had the opportunity, the entire city of Melbourne had the opportunity to learn more, just the basic facts surrounding HIV presented by the professionals, plus the education and treatment. We talked about patient navigation, disclosures, and HIV advocacy. Next, please. And during that implementation, 3-day implementation, each day was very well attended. The third day being a church event, we incorporated a church event. But during the beginning, we had a welcome. We had Miss Alicia McKinley Beach explain what is BTAN. We had Dr. Ronna Cathcart explain HIV origins. We had a HIV professional talk about HIV in adolescents and young adults. We had Ms. Bristol Myers-Squibb talking about, speaking on the Affordable Care Act and the health insurance marketplace for the state of Florida. And also, the second day, I discussed the needs assessment document that I composed. We talked about microbicides. We had a professional talk about microbicides. We talked about the HIV time of events, the treatment cascade. I spoke on HIV adherence education. We had the Area 7 State of Florida Early Intervention Consultant, which is the testing person for the state of Florida, talk about HIV testing algorithms, and we did a presentation on HIV disclosures. On the third day, which was a huge event, we had over 200 plus members, community members attend, and we talked about community mobilization, HIV advocacy, the fundamentals of HIV. We did a treatment education, so to speak, and we had a pharmaceutical company to speak on, ViiV Healthcare, spoke on HIV medications, and I'm very pleased that they've recontacted me just this week. The Faces of AIDS campaign is a campaign by the state of Florida where which it's a truck or a bus, so to speak. It's a media outlet where which they have people living in the state from around the state living with the disease, and it has their story where which they come up and park their big truck or bus. The community members have the opportunity to walk through and read different stories surrounding HIV. It's a big bus wrapped with those people's faces. So I'm very pleased that they recontact me for further engagement. Next, please. And to launch that, we had some of the sponsors to launch that was Unconditional Love Incorporated, my organization, which has been huge. Hazel Bug's ministry, Hazel Bug's has a ministry. She is running for some type of, I don't want to state it wrong, but anyway, she's running for city council seat, a city council seat in the city of Melbourne, which will give us more leverage in what we're doing, B10 Melbourne, and what we're doing within the city. Gilead Science were visible, Vive Healthcare, Bristol Myers Squibb, RS Care Pharmacy, and also the Black AIDS Institute as far as the B10 lunch. Next, please. So the Black AIDS strategic model for B10, it starts out with implementing B10 in the state of Florida. Then it trickles down to the city, which is the city I live in, Melbourne, and my organization, Unconditional Love. And it goes on to talk about the technical assistance and the different programs that may be, brought about during the training for becoming a B10 city. And it goes on to through the treatment education, disclosure, patient navigation, and HIV advocacy, and how those models run about the different B10 cities, which once again, Atlanta, Baltimore, Baton Rouge, Chicago, Dallas, Fort Lauderdale, Houston, Jackson, Kansas City, Little Rock, Los Angeles, Melbourne, Minneapolis, Nashville, New Orleans, Oakland, Philadelphia, Richmond, San Francisco, Washington, D.C., and Kingston, Jamaica. Next, please. The B10 logic model. The B10 logic model has the objectives, activities, outputs, outcomes, and impacts. And I want to touch on the one of the main objectives, the increase early utilization and appropriate treatment, and also to improve treatment adherence in Black communities. Some of the activities for those, which are very basic, are the 4 project areas, implementing the 4 project areas: advocacy, disclosure, patient navigation, and the treatment education. The outputs, within those, for those objectives will be increased treatment education sessions, and also more Blacks retained and linked to care, possibly. Some of the outcomes for those objectives would be increased science and literacy on HIV in our Black communities, and more Black people receiving viral suppression, and the basic impact will be increased viral Black suppression of persons living with HIV and decreased viral loads in Black communities. Next, please. And our B10 chapter structure, it starts out with the Black AIDS Institute, trickles down to my organization, Unconditional Love, and then our co-chairs, John Curry, Sabrina Torres, Gail Robinson. And as we reach each particular project area, treatment education, patient navigation, disclosure, and advocacy, as our B10 discussed and talked about it, our members stated we were best set doing these projects as a group. So instead of having each particular chair, many people felt they were not ready, so we continue to host the treatment education, patient navigation, disclosure, and HIV advocacy as a group. Next, please. And here are the B10 members, the Melbourne B10 members. And our question was, the Melbourne B10 will facilitate an HIV testing, counseling, training. Next, please. And our meeting location for this was at the Golden Corral in Melbourne, Florida. Palm Bay, Florida. Next, please. And that basic agenda for that meeting, we open up with a prayer. We always welcome and do an introduction. And we talked about B10 Melbourne. We explained our mission, the structure, and the chairperson. And we had our actual testing counselor trainer from Orlando come over, Mr. Michael Mormon. He talked about the Orange County Health Department and their services and how they relate to Area 7. And he also talked about, which he will be the facilitator for the testing and counseling training event. We talked about our food menu for those days, and we wrapped it up with questions and answers. Talked about our next steps. Next, please. we came up with a basic budget. Many people might say, well, he's a cheapo, but I come from an organization where less, if you start less, it'll probably work for you. So our basic total program for this came up with $1,100. Next, please. And our flyer, B10 Melbourne, State of Florida, HIV 500 and 501. We are giving the prerequisite to become an HIV testing counselor. For HIV testing certification to become a testing counselor for the state of Florida.
Okay.
And our venues was Grant Street Community Center, once again, Mount Moriah Missionary Baptist Church, for the different trainings. Next, please. So, during this training, we talked about the B10 project areas: treatment education, patient navigation, disclosures, and HIV advocacy. And as the next slides will show, during the training, it'll explain exactly one of these project areas during different parts of the training. And the HIV 500 and 501 session by the B10 Melbourne, what we covered was basic HIV transmission, prevention issues, legal issues, counseling, testing, partner notifications, and referral services. Next, please. And Mr. Michael Mormon, Area 7 lead agency staff, basically covered treatment education, and some of the class comments were basic. I didn't know that, and I kept it real. I didn't want to edit anything. He knows his stuff. And they were saying, this is interesting, how informative he was, and the more you know, they stated. Next, please. HIV 501 session was presented, our HIV disclosure was presented by Dr. Ronald Cathcart, who happens to be the B10 Melbourne professional consultant. Dr. Ronald Cathcart, I will say, he works for Unconditional Love. I work up under him, and the things that he's given me as far as HIV just coincides with what the Black AIDS Institute is giving me. Dr. Cathcart spoke on HIV disclosures, and he touched on the Florida HIV/AIDS Omnibus Act, AIDS Omnibus Act, which much of his discussion and his topics came straight from the state of Florida, as he talked about disclosures to the group. And some of the basic comments that they noted was, I didn't know Florida had an AIDS Omnibus Act. We need to be upfront with our primary physicians. You have to tell your partners, I didn't know the laws were so strict for health providers surrounding HIV. They should have implemented laws in the beginning years of this epidemic. And once again, I gotta commend Dr. Cathcart, who's been phenomenal in the B10 process and the work that we're doing in the city of Melbourne. Next, please. And the patient navigation and HIV advocacy was presented by myself, and we talked about, for patient navigation, I talked about locations and care sites for HIV positive persons. I chair a support group, so I gave much support group information, and also the Central Florida AIDS Planning Consortium, the CFAP, which, once again, Central Florida being Area 7, Brevard, Orange, Osceola, and Seminole counties, there's a consortium where which I chair, being the prevention representative for the state of Florida. For HIV advocacy, we talked about healthcare reform, and we talked about the Florida HIV/AIDS Advocacy Network, FAN, which is an advocate group within the state of Florida. With any time policy change surrounding HIV, you'll get an email, you'll get an alert if you're a part of this group. And I highly encourage, and they're moving forward, B10 members to become avid members of our CFAP and the Florida HIV/AIDS Advocacy Network. Next, please. And that's our sign-in sheet from, actually it was 3-day training, but that's 2 days worth of sign-ins. Keep it real. Next, please. And some of the outcomes from the HIV 500 and 501 testing certification community members will be allowed to receive a certification in basic HIV 500 and the 501. These, once again, these are prerequisites to become a state of Florida HIV testing counselor. During this training, once it is facilitated by Mr. Michael Mormon, he collaborated with us from the Orange County Health Department, Area 7. He is state, facilitated to do this, and community members, once again, will have the opportunity to receive these certificates, and many of them for the trainings have already received the basic 500. We have another training for the 501, which is scheduled July 26th, on a Saturday, July 26th. And once completed, they'll be able to get the 501 part of it. Next, please. And some of the final outcomes of this training: State of Florida HIV testing counselors certifications, more consumers will be educated on HIV, and one of the main objectives that I really am shooting for and is working is the venue, the Black Church, will apply to be an HIV test site for the state of Florida, right in the hardest hit area of the epidemic. And I had to put the little happy camper on there because once I received mine, I was a happy camper. Next, please. So the one-day training that I did, science training to my colleagues on what I did it on HIV in specific population. Working for a full clinic, HIV clinic, many of the nurses, ARNP, are already HIV literate. We deal with consumers of all nature. So I figure best that to do a presentation on what I was taught on HIV in specific populations would better suit them. And I did the HIV and Aging by Homero L. Del Pino of Charles Drew University, Adolescents in HIV by Katrina Kubachov, and HIV and Transgender Women by Ms. Kathy Reebok of Friends Research Institute, and HIV and Incarceration by William Cunningham from the UCLA School of Medicine and Public Health. Next, please. And this is one day of the training. I did 4 different trainings, and once again, that's my basic sign-in sheet. And unconditional love, always step it up. Okay, you guys, I'm gonna give you PISA. You come in. We need this information, case managers. We need this. Black AIDS Institute has given this to John to present to you guys, and I will say it was a success. Next, please. Some of their comments, and I did do a pre and post, and the results, John was informative. Transgender population, talking about their lifestyles, John presented with passion and knowledge. John is confident on his topics. Great presentation, great information. I compare my personal life stories with many of the entities that were presented. And my knowledge of HIV/AIDS has increased, which enhances my job as case manager. Very passionate speaker. And all post-test results were at 100%. Next, please. So I want to talk about the evaluation process. So during each event, at the community evaluation form, I present post the event. The evaluation and monitoring process, well, I'm going to say the monitoring process is better implement. I monitor through my action plan. I'll say that. So the evaluation process is the action plan, the monitoring process, and the community evaluation forms. And I do have results back from some of the feedback from this questionnaire, unedited once again. Next, well, no, you can leave it. You can leave. You can go back. Unedited once again. And one of the questions, the first question is, did you learn something new about HIV and services in your community? And specify. Well, just once again, unedited. General information allowing you to realize it could be you. I learned of the window period at which one can be infected. I didn't know we had that many people in this area that were sick. I learned that AIDS is not a death sentence. That two people who are HIV positive still need to use safe sex practices when they have sex, and to take your medications properly so you don't build resistance to them. Everyone needs to be tested. Be safe. Wrap it up. Don't do unprotected sex. Taking the meds while you're pregnant and the newborn can take something so they can have it, so they can't have it. I learned of some new testing locations that I can tell other people about. People with HIV can have sexual relationships with someone who don't have HIV and not transfer the virus. Now, as I read these comments, I recognize they might not have it exactly how it's stated, but they're hearing something, and I chose not to edit the comments. I will say, do you know someone who will benefit from the services? On that question, I've completed over 400 surveys and 12 events. And I'll say 99% of that is yes. Of that, do you know someone who would benefit from these services? One other question was, please provide feedback on how to improve this education. Some of the basic feedback from different churches. I didn't just take one church, I used different churches. Using different speakers for each segment was very effective, and it kept it interesting. Thank you for the work you're doing in the community. No feedback. Information was very interesting. Can't see anything wrong. They really cover everything during these sessions. The sessions were excellent. More events. Go where they will. Let you spread the word. Many older people need to be educated about HIV. Keep up God's work. Next time, have it in the church and eat afterwards, maybe. Really enjoyed the encourage that no matter what disease, don't mistreat the person. We need unity. The feedback gave me a much clearer view in checking myself and asking others to do the same. The life I saved may be my own. Why isn't the AME more involved to make HIV testing and blood tests for licensed individuals like before? Everyone should have a test included in the annual examination. Once again, those were feedback to improve the educational session. What this individual did not recognize was that the AME Church, whether they're engaged in it or not within the state of Florida, within every county, within the AME Church, there is a test site or a test location within the AME Church. Next, please. So, talking about the evaluation process, my biggest evaluation and monitoring process is the action plan. And the action plan starts with objectives. You come up with a SMART objective, specific, measurable, obtainable, relevant, and they're done in a timely manner. And the one objective was to establish a community. You start out with your problem statement and your goals, and you can actually monitor the success of your program through your action plan. What I've learned through BAI's training, Black AIDS Institute's training, to establish a community coalition made of 15 members from South Melbourne. Well, we not only surpassed 15, we have 30 active members. And my action steps, I sent out invitations for different meetings. I put a timeline on it. I was responsible. And to measure it was have a list of, just have that active list of people that's actively engaged. Next, please. Also, to educate components of black churches on HIV service and organizations. That's a key part as far as the action plan and keeping that in a timely manner. And what we did, how to get into churches, we had Dr. Cathcart, our professional consultant, compose a letter. We used his heading, to send out to pastors. Pastors responded back, coming from an MD working in the field. So that was very active, and once again, that was very aggressive. And once again, we kept a timeline, the responsible people, and how we measured it was evaluation forms will be given. The evaluation forms, which I just went over, to see how much knowledge or what was learned during the sessions. Next, please. So, some African American HIV University successes. Wow, what a great network of national HIV professionals. I've developed some lifelong friends, which I've cried last night because I didn't see one, and I must say that he got on my nerve, but he gave me encouragement, to move forward. And I'm alone and I miss it. I'm so sorry. Well, anyway, B10 Melbourne, the implementation of B10 in Melbourne, one of the biggest successes was the UCLA's HIV Science Boot Camp. Also what Black AIDS Institute, the African American HIV University, gave me was my continual collegiate education for myself. And next, please. So I started out late, but I am a student at Eastern Florida State University. I'm set to graduate in the spring of next year. Some of my successes during this time, with all the work that BAI has, given me, in 2013, I think I was starting the implementation process of B10 Melbourne. At the end of the fall semester, I made the dean's list. The spring of this year, much work from Black AIDS Institute, I made the president's list. And I've been invited to student leadership luncheons within the college campus. So those are some of my personal successes that I can stand here and say I would not have ventured out if it wasn't for my work with the Black AIDS Institute. Having the opportunity, to continue and help me to develop and see who I am and the potentials, no matter where I've been, where I can go with those potentials. Next, please. And some of my next steps: continued collaboration with Black churches and community organizations to host events, continued collaboration with pharmaceutical representations, which the major pharmaceutical companies are on board. I will say our professional consultant plays a great part in that, but nevertheless, they're visible. Constant measuring of the community member evaluation form. I want to hear what these people are stating when we present these events, because that's important. And what our organization is doing is implementing the HIV presentation into the Hispanic churches. If you remember the one photo of me and the one guy, he's a Hispanic pastor. He's come on board, and he's everything I'm doing within the Black churches, I'm showing him to do in the Hispanic churches, I should say. And we had our first Hispanic event success on June 29th of last month. And B10 Melbourne continued HIV program proposals. I'm taking ideas as I sit here. I can remember a presentation done by one of my former colleagues, HIV Made Pretty. That's been in my brain. That's coming to Melbourne within a B10 project. So just continue programs. Next, please. And understand, Ms. Blanchard Blackworld is a B10 member. She's an early Head Start teacher. And she wrote this as part of an assignment for the HIV 500 course she's taken. understand, you would think it was the dark ages, and maybe I could understand why people would think they will get HIV by simply touching a hand. I am a part of B10 Melbourne, and what we want is people to comprehend HIV is not spread by the touching of hands. So come join B10, where we show love, test, and educate, so we can help bring this virus to an end. I had to put that in there because it was coming from someone just in training and what we were training them, and she had reached this comprehensive level from what B10 had given her. And I thank Black AIDS Institute, UCLA, and all the staff members that have helped me compose this program. Thank you.